registered nurse, and this is Nursing Analysis. Today, we shall begin a series that will include multiple volumes on basic nursing care. Our healthcare system is in constant reform. The maintenance for this reform includes both evidence-based practice and system-oriented healthcare. We must ensure the patients that we care for are safe and that we provide effective patient-centered care. This care must be timely and efficient. The Patient Protection and Affordable Care Act helps to reform our healthcare system. What is the purpose of this act? It is to establish a more integrated and equitable healthcare system. This act states that all patients must have access to quality and affordable healthcare. It was established in 2010. The goals obtained from this act include improving access to innovative and preventative health care while expanding insurance coverage. This act is paramount in expanding insurance coverage for young adults up to age 26 years old to be covered on their parents' health insurance plan. It has also eliminated lifetime limits on benefit coverage and arbitrary withdrawals of insurance. No longer are there barriers to the use of emergency services. Let's discuss pay for performance. This model was created as an incentive for healthcare providers, hospitals, and healthcare agencies that meet or exceed the minimum requirements when rendering care with the best quality while utilizing cost efficiency. Those organizations that do not meet the standard will not be reimbursed for subpar care. The Joint Commission. This organization accredits both hospitals and healthcare organizations. The Joint Commission releases its national patient safety goals annually. This release includes areas of concern in healthcare. The standards of this publication include identifying patients correctly to prevent errors, improving staff communication, utilizing medications safely, the use of alarms, preventing infections, identifying safety risks, and prevention of errors during surgery. The Joint Commission provides evidence-based practice solutions for each of its focused improvement areas. They also work with Medicare and Medicaid services, and together they develop what is called the core measures. Now, the core measures can be explained as a method to tell how well a hospital gives care to patients per specific disease or treatment. An example of this, a disease like renal failure or a treatment such as a vaccine. They compare the received care to evidence-based guidelines and standards of care. They identify what percentage of the patients that are being cared for and if they are receiving the best possible care or treatment. They review and utilize this percentage until the organization consistently meets 100%. This makes this a continuous improvement program. Let's now talk about QSEN. QSEN stands for Quality and Safety Education for Nurses. This project was initiated to ensure future nurses would be prepared with the knowledge, skills, and attitudes required to continuously improve the quality and safety of the healthcare system. The competencies included in patient-centered care, teamwork collaboration, evidence-based practice, quality improvement, safety, and informatics. I know you're wondering, what do these competencies mean? Puts the patient first and include them in their care. This is patient-centered care. Collaboration utilizes all specialties. An example of some of these specialties are social workers, case managers, dietary, physical therapy, speech therapy, and occupational therapy. They enable the most involvement to enhance patient care. Teamwork utilizes the doctor, the ARNP, the nurse, CNA, and secretary to be efficient in providing quality care. Evidence-based practice is utilizing tried and true methods with predictable outcomes. Quality improvement continuously addresses deficiencies and is constantly looking to improve the care environment. Safety is continuing to use practices that prevent harm to the patient and all workers involved. Informatics is utilizing technology to advance care and treatment knowledge, skills, and attitudes. Let's now discuss the differences between scope of practice, standards of practice, and standards of care. The scope of practice in nursing is the extent to which a nurse can practice and the limits of that practice. These limits are determined by a set of laws known as the Nurse Practice Act. These laws are determined by the state or territory in which an RN is licensed. Each state's Nurse Practice Act is determined by the State Board of Nursing in each individual state. This scope guides the nurse and their work environment to ensure they are practicing and providing care within the confines of the law. The ultimate goal of the scope of practice is to protect the public by supporting good practice, preventing poor practice, and intervening when practice is unacceptable. The standards of practice are regulated by the American Nurses Association. The standards of practice include assessment, which is collecting comprehensive data that is pertinent to healthcare, consumers' health, or situation. Diagnosis, which is analyzing the assessment to determine a nursing diagnosis. Outcome identification. This identifies the expected outcomes for a plan that has been individualized to the patient or situation. Planning is developing a plan of care that prescribes strategies and interventions to attain expected outcomes. Implementation is putting interventions from the plan into action, including coordination of care and health teaching and promotion. Evaluation. This is the process of evaluating progress towards the attainment of outcomes. Ethics. Ethics are moral principles that govern a person's behavior or the conducting of an activity. The ethical principles that nurses must adhere to are the principles of justice, being fair and equal, beneficence, doing the most good, preventing harm, non-malfeasance, doing no harm, accountability, ensuring the tasks are completed. Fidelity, being faithful, keeping our promises. Autonomy, supporting and advocating for the patient's right to choose. And veracity, telling the truth. Education. The nurse must attain the knowledge and competencies that reflect current nursing practice. Evidence-based practice integrates evidence and research into practice. Quality of practice contributes to quality nursing practice. Communication is communicating effectively in a variety of formats in all areas of practice. Leadership, which is demonstrated in professional practice setting and the profession. Collaboration, working with the healthcare consumer, family, and others in the conduct of nursing practice. Professional practice evaluation. This is evaluating your own nursing practice in relation to professional standards and guidelines. Resource utilization, to plan and provide safe, effective, and financially responsible care. Critical thinking, which is analyzing information objectively, thinking clearly, and making a reasoned judgment by rationalizing the logical connection between ideas. So remember, standards of practice provide guidelines for nursing performance. Earlier, we mentioned ethics and what that included. Before we can move on, we must understand what those terms mean as well. Justice is fairness. Nurses must be fair when they distribute care. Beneficence is doing good and the right thing for the patient. Non-maleficence is doing no harm. Accountability is accepting responsibility for one's own actions. Nurses are accountable for their nursing care and other actions. They must accept all of the professional and personal consequences that can occur as a result of their actions. Fidelity is keeping one's promises. The nurse must be faithful and true to their professional promises and responsibilities by providing high quality, safe care in a competent manner. Autonomy and patient self-determination are upheld when the nurse accepts the client as a unique person who has innate rights to have their own opinions, perspectives, values, and beliefs. Nurses encourage patients to make their own decision without any judgments or coercion from the nurse. The patient has the right to reject or accept all treatments. Veracity is being completely truthful with patients. Nurses must not withhold the whole truth from clients, even when it may lead to patient distress. So, we discussed scope of practice and standards of practice. Now let's talk about standards of care. This basically can be described as that of what a reasonable and prudent nurse would do when caring for a same or similar patient in the same or similar circumstances. So standards of care can be defined as a duty determined by a given set of circumstances that are usually regulated at the national level, although individual organizations and institutions may establish their own standards that could exceed the national minimum. Let's quickly summarize all of this information. The Nurse Practice Act defines scope of practice to establish guidelines by which the nurse can perform skills or services. It also includes statutes, which are rules and regulations that provide guidance to professional nurses, and it establishes education, examination, licensure, and behavioral standards for nurses that protect the public. The standards of practice are established by the American Nurses Association. They define responsibilities of the RN to all clients for quality care. It guides the practice by outlining the scope. The standards of care are established by each institution through policy and procedure. They are about the duty we have to care for patients, no matter the experience of the nurse. Nurses must be able to provide a consistent minimum level of care. All right, well, you know what time it is. It is time for Rhyme Time Review. Today's spotlight has made us aware as we cover topics in basic nursing care. Practice that is evidence-based. We can create an oriented system that is caring and safe. We created the CARE Act to protect our patients and the health they lack. The biggest reward? Care the patients can afford. To prevent and innovate, keeping track of our progress, we shall rate. To all our people, we strive to be equal. No longer will they pay if the patients are treated any kind of way. Improper care aroused suspicion, and this is why we have the Joint Commission. It is our mission to accredit the institutions that transition. Standards are set, and only those that are met will accreditation be kept. We must remember the KSA. These practices will be used every day. We must be aware to use patient-centered care. Teamwork prevents waste as we practice evidence-based. We utilize each station through interdisciplinary collaboration. We know what is meant by quality improvement. We prevent major static by utilizing informatics. As we examine every place, we make sure the patient is safe. We must learn everything that exists in our scope of nursing practice. Remember the penalties and rewards, as this is governed by the Nursing State Board. With our scope, we will pair our standards of care. Nothing will be missed when using the standards of practice. The scope is the guide that we all must abide. It majorly reflects the public that it protects. The ANA also has things to say, as nursing scope should be practiced in a specific way. And to be fair, we must talk about the standards of care. The standards do not include a guide. This is a duty we must abide. Think of the scope as the string of the rope, whereas the standards of practice would be the soap. As for standards of care, we must be fair and keep the soap in the air. As we shower the hope, we must remember to never drop the nursing soap. This concludes the first volume of Basic Nursing Care. Please continue to follow for future volumes in this series. Thank you for all your continued support, and please continue to like subscribe, and share to continue to enable the future productions of educational videos and content. At Medical Prep Institute, we believe in providing quality education to our students to assist them in developing skills for lifelong growth and social well-being. Upon graduation from our nursing school programs, our students are equipped to make an immediate impact in their local community. Whether you are an LPN looking to advance your career or are just getting started in the nursing field, we have a program that will work for you. Contact us today to get started on your nursing career. Our admissions representatives are waiting to welcome you into our nursing community.